In this video, we're going to be looking at the patient prescription. So in order to gain access to the prescription, we're going to go to the patient file screen and click on View All History. Here we're going to see detailed order history for the initial treatment and for any subsequent treatments. Since we're interested in the initial prescription, head down to where it says Invisalign Full Arch, which was the initial treatment, and click on the treatment icon. Normally, when you start a new case, you'll need to enter in the prescription before the ClinCheck is actually generated. So here we're going to see some basic information here about the patient, name, gender, date of birth, so on. What type of treatments are requested, either full treatment, express, or anterior, which is canine to canine. Again, they're going to specify more details what they want from you. To treat reach arch, both upper or lower only. You're able to specify reach teeth you do not want moved or attachments placed on. You can specify whether you want the upper or lower midlines maintained or shifted. And same with the overjet and overbite, whether you want them to try to improve the aesthetics or actually maintain them. More information regarding classification here. If you want interproximal stripping, distalization of molars, whether you'll have extractions as part of the treatment plan, whether you want to maintain or correct crossbites, and spacing, whether you want to leave it as is or to have the Invisalign technicians attempt to correct spacing or crowding. So you have overcorrection treatment preferences, ClinCheck objectives, and special instructions. So the most important here is what you're going to communicate to the technician. There is always screens in ClinCheck where you're able to modify your treatment and have an open dialogue with the technicians. It's important to remember that it's not a static prescription. You're not going to submit it and that's it. It's very modifiable, and that's the beauty of the ClinCheck software. So next we're going to be looking at the ClinCheck software and how to basically use some of the more basic components of it, but just so you feel comfortable enough to be able to use it in your own practice.